in support of patients and survivors, but a very large and groundbreaking study presents a disturbing black and white picture of health disparities for women of color.
Surgeon and scientist Dr. Raul John Dial here with details about that study, as well as new funding for his research on the surprising racial gap of breast cancer. Welcome.
Good morning.
It doesn't seem like that could be so, but the question is, does race matter when it comes to breast cancer?
It absolutely does, and this isn't new news. It confirms what we've already known. So the first thing is, when we see patients, you have to think about their race. We think about a lot of different things, but it's not a time to be, quote, colorblind. So there's a difference in biology. Okay, so African American women, black women, Native American women, they get a more aggressive type of breast cancer. That doesn't mean they only get that and others don't get it, but they get a triple negative breast cancer. Who else gets that? Ashkenazi Jewish women, or women who have that BRCA mutation that we hear about. So when you see patients, you have to realize they have a higher risk, not a guarantee, but a higher risk of a biologically more aggressive breast cancer called triple negative breast cancer.
And what makes triple negative so dangerous?
So digging into the biology a little bit, our cells have little antennae on top of it. I think we have a graphic where you'll see they're like docking stations on the cell surface. And those docking stations, which I call biological antennae, allow us to develop drugs that can find them based on an antenna. So you can be targeted in your approach. Triple negative is bald. The cancer cell lacks those receptors. So we haven't had the breakthroughs or the developments in new medicines for triple negative breast cancer. So that's the category of this specific aggressive cancer type we're talking about.
This study also suggested that when it comes to breast cancer, that the Latinas, African American women, Native American women, they're receiving the wrong type of treatments?
Sometimes. So first we talked about biology. Race does affect biology. I mean, just under the microscope, looking at it at a genetic level. Then the question is, we have medicine and we have screening protocols, but certain groups of women aren't getting those treatments, aren't getting that screening. And so what happens, and that can be based on race, it can also be based on income. Poor women, women with less resources, aren't getting the treatments they should. So that's on us, and that's healthcare delivery. So first is biology. So African American women, black women, they get a more aggressive type of cancer, and then we're not screening them as well, we're not catching it as well, so when they come to us, it tends to have spread to the body. It tends to have metastasized. And that's another hallmark of this triple negative breast cancer, that it spreads more aggressively than estrogen positive or progesterone positive breast cancer.
Now we have to say congratulations to you, because you received a major breakthrough award and some funding that's going to go towards more research, right?
Yeah, I mean, I feel two things. One is humility, because there are established scientists who are saying, hey kid, the stuff you're working on has some promise. And in the scientific world, I'm still a kid, even though I'm 42.
I was just going to say, you're never really a kid, but go ahead.
And the other thing I feel is responsibility. This is taxpayer money, and the government has a limited pool, the National Institute of Health, and they choose different scientists across the country to say, we have the best odds with you, we think. And so what I want to do is just really make the most of it, of course for patients, but just out of respect for the taxpayers who the government distributes their money.
Well, we appreciate what you do for our audience, but obviously the bigger picture is you're doing this amazing research, so thank you for that.
That's my passion.
Thank you.
More information about this topic